is cancer. So there's a lot of patients dealing with this problem, and I use with them, like I told you, I treat them like if I was the patient. And that's the best way to treat the patient. And about listening to the patient, because in America, there is not all over, but the communication between doctors and patients are not good. They got, they give you, they cannot sleep. They give you sleeping medication. If they get depressed, they give you for depression, and then they got everything for everything, So they come with a big box of medication, and you know what? The first thing I do is slow down, tape it down, take it away, and they start to do much better. Just, in medicine, like in life, you need to use common sense. It's very important to use common sense. So if somebody comes with pain, well, you take care of the pain, and then you talk to the patient. Otherwise, you will never talk to this patient who is in a lot of pain. In Mexico, we got more freedom of choice, more freedom of treatments. That's the reason people go over there. I would like to show you some slides. This is Mexico, as you can see. I'm right on the El Paso Juarez area, which is right on the middle between the United States. Some people say, there's a saying, poor Mexico, so close to the United States and so far from God. That's what they say. I just say what they say. No, I like to leave it because you got advantage, patients got advantage to come down and get treatments. You can see there where is Juarez and then El Paso, which, by the way, things are getting much better. Thanks the Lord. Next one. Let me show you one. So it's a nice area. That's welcome to the coming in, because some people they think going to Mexico is like you will see a big sombrero and mariachi, and that's it. No, there is doctors too. That's the clinic. When I make this clinic, I say I'm going to make a place that looks like a hospital, but looks like a house. So people go to the clinic, and like you can see, it's a house. Even I don't have any sign because I don't need it, because people, they know me and they come. We pick up in the El Paso airport, and they come and they go. We give you his own room, and then they come along with somebody else who participate in the treatments, and then they go to eat normal food, because food in the United States, the hospital is not the best, as you know better than me. That's the Good Samaritan Medical Center. It's a space. I try to be comfortable because, there's nothing like home. But if you go, going to a hospital in America is kind of stressful. Everything is closed, and too much security, too much X-ray, too many tests. I don't like to do too many tests, because when you listen to the patient many times they give you what you need, so you can avoid and save money and time. Because when somebody is dealing with cancer, the clock starts to run against the patient. So nothing is important until they say you got cancer. Then nothing is more important anymore. What used to be important is not any important anymore. That's the patio, one of the patios. The beds, they are simple. We got Amish, we got Mennonites, we got American. Amish patients, they call to American people, they call English patients. So we got English patients too, which are you. So people like you, which are American, but they call English. Amish, I'm sure you are familiar a little bit with the Amish, but they got a very simple life, but they got his own problems too. They don't need too good. That's a hospital. That's my hospital. I got a nurses station, and I got nurses. I got a lobby that people go and read, and then nurses, which are most of them speak English, and if they don't speak English, well, they better learn, because the patients, they don't learn too very easy Spanish. They can say yes, no, That's the kitchen. That's the kitchen. Our diet is very important in the treatment of cancer. I don't believe in magical bullets, you know. I don't believe like eating just green vegetables, you will get cured from cancer. No, I believe in the holistic treatment. Treat the whole body, the mind, the body, and the soul, el corazón. It's very important to treat the whole person, not just the symptoms. And it's always important to go to the root of the problem. You know, going to the root of the problem, that's something that we need to learn every day more and more. Well, there's some Mennonites there. That's the leading cause of death in the United States. As you can see, number one, cardiovascular disease, stroke. So we got plenty of patients because chelation is very important. Not just chelation, some other things like